Hi, everyone. Welcome to ABC Home Healthcare Professionals video of the month. I am so excited to introduce you to Patty Lamone from Most and Leone Medicare Advisors. I am going to hand it over to her, but I'm super excited for you to be able to tune in on this segment and learn all there is to know about Medicare. And there is no one better to be able to advise you than Patty. And with that, Patty, thank you so much.
Thank you, Michelle. Thanks for having me. I really appreciate it, and I'm really excited. Um, Again, my name is Patty Lamone, and I am an independent licensed insurance agent, and I specialize in senior healthcare plans, otherwise known as Medicare. I work with a great team of Medicare experts at Mott and Leone, and my mission is pretty simple, and that's to help educate people and help them navigate the Medicare process, not only when they first sign up, but the whole time they're on Medicare. Researching your Medicare options can be so cumbersome and time consuming to find the right plan for your specific needs. And because healthcare is always changing, keeping up with all the shifting rules and regulations is so overwhelming for the average person. And where I'm licensed and certified, which means I have to take these yearly exams, annual certifications to keep up with these changes. I do it every day. I'm a free resource and I stay unbiased. My goal is to educate someone on the plans that best meet their needs and help people avoid penalties and provide support all year long. Instead of calling into a call center where you may get someone different every time, I will be available to answer all your Medicare concerns and questions.
That's awesome, Patty. And I work in this business, and so I know a little bit about Medicare, but I always am learning something new or have questions. And I'm sure that so many people that are watching this video today are going to have the same kinds of questions, or at least they know someone that will. So one of the first questions that I get is, what is the difference between Medicaid and Medicare? So can you elaborate on that a little bit?
Sure, I get this question quite a bit. So both Medicare and Medicaid are government programs, and both programs help pay for people's health care costs. That's where the similarities end. Medicare is generally for people who are older or disabled, and Medicaid is for people with limited income and resources. Medicare is governed by the federal government, and Medicaid is joint federal and state. Medicaid will pay for costs not covered by Medicare Parts A and B, and may also include some additional benefits and services. And the two programs can work together to cover most of your healthcare costs if you qualify.
And so oftentimes people think, okay, I'm enrolled for Medicare. It covers everything. I have nothing to worry about. However, again, being in the business, I understand that that is not the case. It is not all inclusive. So can you touch upon that as well?
Sure, Medicare is certainly not all inclusive. Medicare Part A and B is also called Original Medicare. Original Medicare is what the federal government provides to help the cost of health care. And different parts of Original Medicare cover specific services, like Part A, commonly referred to as hospital insurance, and it primarily covers hospital stays and some stays in some skilled nursing facilities. Part A may have a monthly premium if you or your spouse haven't worked in the United States for at least 10 years, paying those taxes. And there's also a Part A deductible. For 2023, it was $1,600 per benefit period, which can get to be expensive if you're in the hospital more than once per year. And Part B is considered medical insurance. This covers your doctor's visits, lab visits, outpatient procedures, just to name a few. And there's a deductible associated with that as well. In 2023, it's $226 per year. And Part B also has a premium associated with it. And Social Security determines that, and it's based upon your income. So Original Medicare A and B helps, and I keep stressing that word, helps pay and helps you with your healthcare costs, but it is not comprehensive. It covers about 80% of the cost of Medicare covered services.
So Medicare Part A covers 80% of hospital and inpatient care. So that would be intensive care units when you're in the hospital, any labs and x-rays that are done in an inpatient setting, skilled nursing services like a nursing home, and rehab stays after a qualifying inpatient stay. While Medicare Part B, on the other hand, offers 80% coverage for doctor's visits and outpatient care. So that would be something such as annual wellness visits, preventative services, lab tests, diagnostic x-rays, mental health care, durable medical equipment for the home, so such as walkers and wheelchairs, things like that, as well as physical therapy, occupational therapy, and speech services, and ambulatory and ER services. So while 80% is certainly a big help in affording care, and those are a lot of benefits right there, coming up with the extra 20% of costs out of pocket can still be quite expensive for so many people who are living on limited income post-retirement. So what are their options there to be able to alleviate the cost of that 20% that they are going to owe on, services that they need through Medicare?
Great question. There are two ways to get that additional coverage. A Medicare Advantage plan, which is also referred to as Part C, or a Medicare Supplement plan, which you've also may have heard referred to as Medigap. So the Medicare Advantage plans were established not too long ago, but is to allow private insurance companies to manage the Medicare benefits. And it works just like an HMO or a PPO that most people are already familiar with. You can't be denied coverage based on your current financial or health status, including those pre-existing conditions. So the Advantage plan companies must cover all the services that Original Medicare offers, as well as follow all the rules set by Medicare. One of the benefits of the Advantage plans is that it will also cover some additional benefits. It's an all-in-one plan. Some of the extra coverages, like some vision, some hearing, dental, some wellness programs, just to name a few. Another benefit is that most Medicare Advantage plans include the prescription drug coverage, which is also called Part D. And the annual limit on the out-of-pocket cost for covered services is capped, where in Original Medicare, it could be 20% of an unlimited amount of money, which can be pretty scary. Some of the reasons people may not choose a Medicare Advantage plan is the unpredictability of the cost throughout the year, and benefits can change on a yearly basis, which is where I could come in to educate the people on the changes. Some plans have a 0 monthly premium, which is wonderful. And some of the copays and coinsurance when you visit a doctor will come into play. So yearly health costs can vary depending on your health. Another disadvantage may be there are networks and network rules associated with Advantage plans, as many people are familiar who are already on HMOs and PPOs through their employers. But for some other people, that doesn't matter. Another way to get additional coverage is through the Medicare Supplement plans. Since there are so many copays and deductibles with Original Medicare and it's not capped, private insurers sell Medicare Supplement plans that help pay for those copays and coinsurance. While the Medicare Supplement plans are standardized in terms of the coverage they provide, costs can vary depending on the plan and the company that you go with. And some of the benefits of the plan, of a supplement plan, is the predictability of your out-of-pocket expenses. You know your monthly costs, what they will be, and what services are covered. Another benefit is that you're not restricted by networks. Those two things may bring peace of mind to some people, especially people with big health issues and finding themselves at a doctor's quite a bit. And the reason some people may not choose a supplement plan is because those monthly premiums are expensive. They range anywhere between $110 to $350 a month in Massachusetts. And that's guaranteed whether you use any of the services or not. You're going to have to pay that monthly premium. Since supplement plans only help with the Original Medicare copays and coinsurances and deductibles, you also have to get a separate plan D, which is your prescription drug coverage, which also has a monthly premium as well. So that's adding on to your monthly costs. You also have to find coverage or pay out of pocket for your other healthcare costs, such as vision, hearing, and dental, which can be quite expensive. So when it comes to getting additional Medicare coverage, one size doesn't fit all. What works for your neighbor may not be the best plan for you.
I mean, that is a ton of information, and certainly a lot for anyone to digest, especially some of the folks watching this video right now. And that leads me to my next question for you, which is, since there are so many people that are going to be watching this that have questions that may be approaching the age when they will be eligible for Medicare, or maybe they're eligible for Medicare right now, how do they go about enrolling for Medicare? Because it's not just automatic when you turn 65.
Correct. And sometimes it can be. It depends on your situation. So there are two ways to enroll in Medicare. One could be automatic. That's only if you're collecting Social Security benefits at the current present moment. And that's for people who have disabilities and have been collecting those Social Security benefits for at least 24 months prior to your 65th birthday. If you're not receiving Social Security benefits when you turn 65, you'll have to apply. And Social Security handles the enrollment in Parts A and B, and they'll review your records to see if you qualify for Medicare, and they'll also determine if you qualify for premium-free Part A and what that monthly premium for Part B will be based on your income, because that could change significantly. You can enroll physically by going to the Social Security office or by making an appointment to enroll over the phone, or you can apply online. And I can also guide you in this process. So to be eligible for Medicare, you must be a U.S. citizen or a legal resident, 65 or older. But there are times when you can be on Medicare under 65. It's with a qualifying disability, and you have to be collecting Social Security for at least 24 months. So when you turn 65, you have a 7-month initial enrollment period for Medicare. It includes the month you turn 65 and 3 months before and 3 months after. So coverage begins on the first day of your 65th birthday month if your enrollment is completed during the 3 months of your IEP, which is your initial enrollment period. And your coverage start date may be delayed if you sign up any later than your birthday month. The rule says by the time you turn 65, you either need to be on Medicare or covered under an acceptable health insurance plan. And if you aren't, you will face penalties, which is where I come in as well. I can help you navigate that. So for people who are already enrolled in Medicare, many people don't realize they should review their plan on a yearly basis, because not only could your healthcare needs change, but some of the plan benefits could change. And right now is the time of year that you'll be receiving all those annual notices of changes from your insurance company. You'll see all these ads on TV, and they get very, very confusing. You can only change your plan at certain times of the year, and this period coming up is called the annual enrollment period. And it runs from October 15th to December 7th. And this is a time where you can join a Medicare Advantage plan, switch a Medicare Advantage plan, or drop a Medicare Advantage plan and pick up a Medicare supplement plan along with a Part D prescription drug plan. There's also a few more enrollment periods. One is coming up in January 1st through March 31st. And that's an open enrollment period where your coverage doesn't begin until July 1, where you can enroll in Parts A and B, or both if you missed your initial enrollment period.
If you are thinking of enrolling for Medicare, or you know someone who might be, right now is the very best time to reach out to Patty and really get your questions answered from her, and review what are your needs. Because as Patty, as you said, you know, it's not one size fits all, and Medicare itself is highly customizable. So even if one spouse has one plan, the other spouse might not have that plan, and that's totally okay, because it is not a typical private insurance and family plan and things like that. So there is just so much that we could cover that we can't do in a short video. So that is why I cannot stress it enough to everyone who's watching. Please do yourself a favor and contact Patty. And Patty, can you just tell them where they can contact you?
Sure, absolutely. My name is Patty Lamone, and my cell phone number is 617-513-0389. And my email address is Patty with an I at maustonleone.com. So it's PATTI at MAUSTANDLEONE.com. And like I said, I'm a free resource, unbiased, and my goal is to educate you on the plan that best fits your need and try and help you avoid any penalties.
That's amazing. And so when people call you, they set up an appointment with you. Are there certain things that they should come prepared with when they meet you to get the most out of that appointment? Or do you usually just have a consultation and then schedule a follow-up appointment?
It depends on their situation. If they're just turning 65, then we'll go through a series of questions. If they're on any prescription drugs, I would like to know, and they could have those to save some time as to what prescription drugs they have, how often they take it, what kind of prescription drug it is, whether it's a pill or a capsule, and their dosage. That would be very helpful. If somebody's already on Medicare, their Medicare number would be helpful, and a list of their doctors that they currently see, any specialists that they currently see, how many times a year they may go to these specialists, and any other health issues, and what would be important to them in a Medicare health plan.
Excellent. Okay, perfect. Well, again, thank you so much. I cannot thank you enough for being our featured guest this month. And I think it's perfect, especially with the enrollment period that's coming up. I know you're a wealth of knowledge and you're just a wonderful person. I always enjoy chatting with you. So thank you once again. I appreciate it. And I'm sure the audience appreciates it as well.
Thanks, Michelle. I appreciate it. And I really look forward to helping your clients or whoever's watching this. And please feel free to give me a call.